Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, autism is a unique way of experiencing the world where individuals might see and interact with it differently than most people do. It can involve challenges in communication and social interaction, as well as having special interests or routines that are more important to them. In this universe, some rules and communications are written in a code that only they can understand. Well, think of it as a fascinating journey into the unknown, where each child or adult is an explorer with their own map, leading them through the terrain of their unique minds. However, this uniqueness is characterized by the challenges of its own. On the program today, we will explore the multifaceted aspects of autism spectrum disorder, including its causes, diagnosis, and management. We will also attempt to shed light on the challenges faced by individuals with ASD and their families, while highlighting the significance of early intervention and support services. To help us get through with this is Dr. Doris Izuwah. Dr. Doris is an autism specialist and behavioral analyst, and she joins us virtually. You're welcome, Dr. Doris.
Very much.
How are you doing today?
I'm fine. I'm good.
And thank you for availing us your time today.
My pleasure.
Now let's talk. How long have you been involved in diagnosing and treating children with autism spectrum disorder?
Okay, I started working with children in the spectrum for the past 20 years now. It's basically my life.
Wow. That's interesting for you to have been working on this for the past 2 decades. All right, now let's look at a brief overview of what autism spectrum disorder is, especially for our viewers that probably don't understand what it means.
Autism spectrum disorder is a neurodevelopmental disorder that affects a child's ability to communicate, socialize with his or her environment, and at the same time, it comes with somewhat repetitive, rigid routines and behaviors. So basically, when a child has issues with communication, socialization, and behavioral issues, you could say that child has autism. It's a spectrum, rather.
Wow. Okay, can you explain the process of diagnosing ASD in children? Because you just mentioned that that's how you get to know that a child has autism. So can you please explain the process of diagnosing ASD in children and what are the key indicators you look for during assessments?
Honestly, there is no medical diagnosis of autism, although because of genetic influence, you could see some syndromes that come with autism. So when it comes to diagnosing autism, first of all, we have the surveillance, when mothers feel that their child is different. And once they feel like that, or during developmental screenings, during immunizations, in school settings, somebody might still have that, might feel that this child is different or have some developmental delays. That's the same surveillance. They can now send the child to the medical doctor, their pediatricians, and that is when they do the screening test. So we have tools. We have various screening tools the pediatrician can use. And if they pass that screening tools, then we also have other diagnostics tools that we can use to diagnose autism.
Okay. So what are these tools?
These tools are specific to doctors and the people that use it. They're different tools. Like we have the diagnosis statistical manual is a basic one. There's so many of them. But the important thing is, does your child has autism or not? I tell parents, it's before you get your diagnosis, because it can take a while for you to diagnose a child with autism in Nigeria because of our problems, late diagnosis, late presentation, poor resources, and financial implications. We don't get to diagnose our children early. Basically, before a child is 3 years, you will have that. The child would have had those signs, those red flags that could tell you, oh, I think this child is different. So with that, we see our children quite late. Sometimes are diagnosed as late as 15 years, based on history, observation. Because some of them, it's not one visit to the medical doctor is not just enough to diagnose a child with autism. Sometimes some of the symptoms you might not even see it. The diagnosis is based on features, symptoms, signs, observations, what you have seen those children do. It's not like maybe they are sick and they go to the doctor and they do a medical test and they say they have autism. No, it's not like that. So it's behavioral, it's what you observe, the history you take from the parents, and how those have actually affected the child's ability to function.
I'm sure a lot of people are at home right now and they're curious to know these signs, these symptoms, what are those things to look out for so that they can begin to,
Yes.
observe their children. So what are those signs and symptoms that they need to look out for when it comes to autism?
Okay, the signs and symptoms, remember I mentioned communication, social interaction, and behavioral. So when it comes to social interaction, sometimes they don't have eye contact. Your child is not looking at you. The child is not socializing. The child is not maintaining relationship. It's not initiating. Will prefer to be alone. Sometimes aloof, indifferent, doesn't want to join in what others are doing. These are the social interactions. So usually when you see this child just on his or her own doing his or her own thing, not really doing what other people are doing, sometimes have little awareness of themselves to talk of even knowing other people is it. That they're just in their own little bubble and they prefer to play alone. Then when it comes to language communication, sometimes they're non-verbal. They don't have any form of they don't have words. I've seen 4-year-olds with no words. I've seen 11, 15-year-olds with just one word or two words. Sometimes when they have those words and they're making sentences, they don't apply it to themselves and in back and forth conversational speech. They just use it for their needs. I want water, I want food, I want toy, but they are not able to sit down, even at the age of 15, they're not able to sit down and talk to you one on one. They're able to retell a story, tell you past experiences and what happened to them in school or at home in your absence. They're not able to express themselves. Sometimes they have echolalia, meaning that when you say something, they just say the same thing. For example, how are you? They repeat, how are you before they answer. Sometimes some speak in a robotic manner because they have copied it off from maybe television or cartoons, so they speak like a little professor, as if they are really speaking in a robotic manner. And also, when it comes to socialization and communication, they don't those even when they have those words, they're not able to use it to socialize and relate with other people. And some might not even understand facial expression. They ignore you. They don't obey your instructions because they're not able to process what you have to talk to them. That is social interaction and then language. The third one is behavioral. Sometimes they have repetitive behaviors such as hand flapping, hand wriggling near their face, rocking themselves, sensory issues, closing their ears as sounds, flickering the lights off and on, gazing at patterns. Some of them might have rigidity. Oh, the parents will say, oh, my child can play with toys. But if you look at those play concepts, there is rigidity.
Quite interesting, Dr. Doris. In all of this now, how do we begin to detect the major causes? Like, what could possibly be causing some of these things? What are the current theories or research findings that are related to autism? Is it genetic? Is it environmental? Or are there other factors, that play a significant role in causing autism?
Okay, when it comes to causes of autism, is so ambiguous. There is no known cause of autism, but there is genetically influenced theory because we feel due to those genetic theories, that is why we have it being more in boys than in girls, and we find it more in some syndromes than others. No, but we have risk factors and predisposing factors, the theories that have been put out there as a possible cause of autism. So, like you
Okay.
said, genetically influenced, genetic factors, environmental factors, biological factors. So I've talked about gene. They have found some gene associated with autism, but we don't really, we cannot categorically say it's because you have this gene, that is why you have autism, like in Down syndrome. But then when it comes to chromosomal conditions, genetic factors that are related to autism, we have some like Fragile X, tuberous sclerosis. We just find it more in people with autism. That is why part of the reason why it could be genetically influenced. But the environmental factors includes heavy metal toxicity, pollutions, environmental toxins like pesticides, mercury, infections like viral, bacteria, other autoimmune diseases, difficulty in detoxification, removing heavy particles, heavy metals from their system, and also difficulty in delivery. Maybe a child didn't cry well at birth, or the mother took certain drugs like anti-seizure drugs when they were pregnant. All these things are just predisposing factors. There is no known cause of autism. So we, as much as we try to find out, maybe doing certain investigations which are not really available in Nigeria, it does not tell us whether a child has autism or not. But it helps us to anticipate certain issues or intellectual disabilities that could come with our children. For example, if a child didn't cry well at birth, that child would have what we call beta asphyxia. Depending on the severity, it would make a child not to perform well in school. But there is no known cause of autism, and parents shouldn't blame themselves. And then in Nigeria, our cultural setting is being associated with spirituality and a child being possessed. Let me just give you an example. There was a child I diagnosed with autism at the age of 3 years, and the parents were so happy. They thank God it's autism. There is a name to it, because at night our kids could have sleep issues, so they wake up in the night around 12 a.m. and they're screaming, sometimes laughing 2 hours, and the neighbors will be complaining there's a witch having meeting in the night. So the parents were so happy to have a diagnosis of autism. I was so shocked when when I saw the excitement on their
it's the trend.
Called autism. Yes.
Nobody
Yes.
believes, everybody thinks it's something spiritual. They don't even think that there is more to it than just looking at it in the spiritual, with the spiritual lens.
Absolutely. Yeah, and it has also affected our children's ability to seek help, because parents would prefer to go to spiritualists, to go to church, mosques, to cast out the demon. There's another story. One of my kids, prior to intervention, was taken to a spiritualist for about 3 years, where he was changed. Yes, he was changed. He was malnourished. He wasn't given enough food because he wanted to starve the demons.
So, just like the example you gave a while ago, explaining some spiritual setbacks, people thinking it's spiritual, what other encounters have you actually had when you're diagnosing children with ASD? Looking at children now. And I've also heard that it's also present in adults. So I'm beginning to look at the correlation. How does it develop from the children to the adulthood? Especially looking at the kind of work you do now.
Marital disharmony or family discordance, because the separated homes, divorce, because one partner felt that it was the other person, especially the mothers. They were accused of giving autism to their child. It was their fault that their child had autism. So I've seen a lot of that. And I've seen neglect whereby this child is not talking, and why should I put my resources in getting help for this child? So you see a family, you see a partner struggling. Maybe the man's struggling because the wife wasn't interested, or the wife struggling because the man wasn't interested in helping their child with autism.
Some people even live in denial.
Yeah, I've seen a whole lot of that. And it just took one parent to stand up, like I said, and said, I'm going to find help for my child. I'm not going to wait for the other partners. And when they now bring the other partner for assessment, it's my duty as a behavioral analyst to explain to them what autism is. In fact, before telling them what autism is, remember, it's your observation. We had to show them what their child cannot do. For example, if we, in terms of social interaction, I will ask the parents, is your child looking at you when you call his or her name? Does your child respond to you when you call his name? Does your child answer you? They say, of course, my child answers me. I said, okay, can you call his name, for example, Doris? It will say, Doris, Doris. Up to 10 times the child is not turning to look at them. So I had to, that's why it takes up to 5-6 hours sometimes after the parents call your child's name, ask him to do this. We had to make the parents observe and look at their child from our own angle. And before they leave, they would have been convinced that this child needs intervention and needs appropriate resources to help him or her. And then by the time we now explain to them, we feel your child could have autism based on 1, 2, 3. Usually they feel much better. And you have to give them time to, you have to show empathy. It's not easy receiving those diagnoses sometimes, most times. So you have to give them time to cry. We've seen a lot of crying, people breaking down, being extremely very sad. We need to give them that time, because most parents know something is wrong, but they needed someone to tell them that and make them see that. So you have to let them grieve somehow. It's very important. And then accept it, because when they accept it, you can then work with them.
So let's talk. Are there different or subtypes or levels of severity within the autism spectrum, and how do they affect a child's development and functioning?
So we don't really have, usually before, I think 2013, when we're still using the Diagnostic Statistical Manual for Autism, that was in 2013, autism had different subtypes. Like we had the Autism Spectrum Disorders, we had progressive developmental disorders, we had childhood integrative disorders, we had Rett syndrome. But all those things are no longer in place now. We just have autism spectrum disorders. Autism spectrum disorders, they made it a spectrum. So you can be, for example, it could be number 1 to 10, then you can fall between 1 and 5, 3 to 5, 7 to 10. That is why it's a spectrum. No child or no two children with autism are the same. No, they're all different. So what we have now is level 1, level 2, level 3, just like mild, moderate, severe. So, for example, level 1, they just need some support, and then they'll be able to help themselves. They'll be able to have their executive functioning plan and do things for themselves. Those ones, they can help them in regular school setting with minimal support. Then we have level 2, they need substantial support. You could also do mainstream and also therapies, different forms of therapies for them. You can help them with daily living, even still needs lots of help in academics. And then we have that is very substantial support. That is what they need. For those, it means that most time they will require assistive living all through their life.
Wow, I know we've been talking and we've been laying emphasis on early years whilst talking. So I want to understand, how early should early be? Like from what age should parents begin to observe their children when it comes to detection for autism spectrum disorder?
When it comes to early intervention, we encourage parents to start before the age of 4 years, maybe from 2.5, 3, 4, early interventions. But we have red flags, like I mentioned before, in terms of autism.
Okay.
These are warning signs. We call them red flags, early warning signs. You would notice, you will know something is wrong, even if you didn't have diagnosis. For example, at the age of 6 months, this child is not making eye contact. When you look at your child, and the child is babbling, very happy that you're with him, wants to play with him or her. Some of our kids are not doing that. They don't make eye contact. They're not cooing. They're not blabbing. They're not smiling when you smile at you. They're not smiling back at you. They're not participating in vocal tune, tone taking. For example, when you say coo, 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 the child is supposed to respond back to you, right?
Of
But some
course.
of them might not do that. When you say peekaboo, peekaboo, a child is supposed to laugh. So our kids are now doing that. These are all early warning signs. And then at the age of 12 months, 1 year, this child is still not attempting to speak. But when a child is not speaking at 12 months, but is having social interaction, doing peekaboo with you, queen, doing other things with you, it might not be autism. Remember, I said it's a spectrum, and they must meet the criteria for social interaction, communication, and behavioral issues. Then at the age of 12 months, this child doesn't have non-verbal communications. You know, in those days when you look at your child or your parent looks at you, you will know what they're trying to pass on, the message they're trying to pass on. But some of our kids, they don't have that. They're not pointing, they're not waving, they're not grasping things, they're not responding when you call their name. Although some parents will be in denial, said, "Oh, he's too busy, he's watching cartoon, that is why he's not responding to me." No, they're parents. Even if they're watching cartoon, they're supposed to respond at least tone towards the person calling their name. I want to make it clear to parents because I hear a lot of that. "Oh, doctor, because he likes this toy, that is why he's not responding to me." No, that is wrong. And then sometimes some of them are indifferent, and you could still see some repetitive behaviors like self-stimulatory behaviors trying to regulate and stimulate themselves. You see them flapping their hands, rocking, running around in circles, very hyperactive, fixated on a single object. They're not playing with toys. At least at the age of 12 a month, 2 years, when a child comes into a place with lots of toys, they should be attracted towards those toys.
Of course.
Play with them. But you see, our kids, they'll just pick one toy and be playing with it and be doing that. You know, those things. Some of them have over sensitivity to textures. So parents will complain, "This child has refused to eat food, only takes golden morn or pureed food," even at the age of way into 2 years, 3 years. You see them also having oversensitivity to sounds. That one is glaring, the covering of ears like this.
Wow.
Meanwhile, they will scream and shout when they want, and then some of them smelling everything. And then they don't like change. I've seen kids, they prefer to sit on a particular chair, their green chair, before they will eat. No rigidity. You must get my chair, my plate, my spoon.
Of course.
These things are real. I know of a child, he was in school, I think he was 4. So he did his nursery school, I think that was pre-kindergarten, was in the blue class. So the next day they took him to the orange class for nursery 1. Do you know that he would take his backpack back to the blue class? So it was stressful for the school. So during when it was time to eat, he would run back to the blue class to eat. And after eating, then he would go to the orange class to take lessons. That's how serious it was. And then they don't like change. Recently, a parent I interacted with told me that if he did take his child from school to other place apart from the house, using another route, they'll be screaming and shouting in the car. They just want things to be in a particular way. I've seen adolescents, if you don't tell them what they expect, I mean, adolescents and adults with autism, if you're going to schedule timetable for them and take them somewhere else the next day, you must tell them. In fact, some outrightly will ask you, "Where are we going to? How many hours will it take? Who are we going to see?" They want to. They want
to know everything ahead of time.
And even when you're in the church, sometimes they ask you, "How long will the mass last?" So it wasn't fast. If you say 2 hours,
like they just want to be by themselves,
2 hours, or they will walk out. So they want that rigidity and organize their thoughts for them. Safer, they feel safer in an organized, structured manner. And we also have, still in early warning signs, we've had lots of languages, lots of developmental milestones that's each sign of autism, where parents tell us, oh, doctor, my son used to take all of these, and right now I don't hear them anymore. So these are all warning signs. If you see these warning signs, please race to your doctor and tell them about this, and they will do screening for you.
All right, thank you very much. Let's go on a quick break. When we return back, we'll be discussing the benefits and as well as management of autism spectrum disorder. Stay with us. Back viewers, we're still discussing autism spectrum disorder with Dr. Doris Izuwah. All right, Dr. Doris, thanks for that insight earlier. So once again, let's talk about some of the benefits of, early detection of autism spectrum disorder, because we need to know what are the benefits that it can actually add to you knowing early that your child has autism.
So when it comes to early intervention, the brain is still malleable when a child is younger, and the child has the ability to learn more. You can expand the brain. You can put in more inputs into the child to learn that when they are older, and schools are better able to work with a younger child than an adult. Remember, when it comes to autism, they prefer rigid routines. So if you're able to teach them one thing that is good about autism is that whatever they have learned, they stick to it. So imagine ways, and unfortunately, it takes time for them to learn those things. And skills in autism do not come naturally to them. You grow up learning how to brush your teeth, right? By observation, observing other people, imitating the actions of others. You learn how to dress, your fashion sense, know that you have to get up, your executive functioning, plan yourself, organize your life. Do you wake up and go to work, right? Wake up and go to school, right? For our kids, it doesn't come naturally to them. So what early intervention does is that it avails them the opportunity to learn, absorb, categorize, plan their thoughts and their minds, and then use it so that by the time they are older, at least they're learning something and coming towards parity with their developmental milestones compared to peers. For example, if you don't teach a child with autism how to bathe, I'm telling you, by the time they're 20, you will still be the one beating them. And who wants to do that for their life? Yes. I have 18-year-olds that their parents are still supervising their births. Yes. So early intervention gives you opportunity to teach your child to learn early and apply it in life, because when they are older, it becomes more difficult to get them to do those things by themselves or even to do it properly. If we don't teach our children with autism how to calculate, to learn their ABCs, sounds, talk, when they're older, they might not get to do those things. Sometimes some of the skills become better when they're older, they learn, and some of the signs and symptoms improve with time, but at what rate? It's not really that fast. Sometimes they even deteriorate as well, and you see this child just living like a vegetable at home because there was no skill training when he or she was smaller. So looking up this child, praying about it for things to get better. Most times it doesn't, because faith without good work is dead. You have to start that early intervention. It's even cheaper because this child will now learn skills, and you don't need to pay somebody else when they're older to do those things for them. I know a family that has to pay someone to do 24-hour care for their child as an adult with autism. And I tell you, I have seen 4 cases of adults with autism losing their parents who were their primary caregiver, because sometimes you see a spouse, you see a partner leaving their job to take care of that. It becomes a full-time it becomes a full-time job, because you cannot leave this adult and do other things and have that self-actualization in your workplace. Maybe because this child wasn't didn't receive the training when he or she was small. And then what happens to this child when you're no longer there? Have we actually asked ourselves those questions? Who are you doing with that child that is totally dependent for? It doesn't get better. You need to do something when they're younger for them to have somewhat independent life when they're old, and then do it consistently as well. Carry everybody along. So perhaps when we as parents are no longer there, the child, even if they're staying with somebody, they wouldn't be a burden, a huge burden on the person they're going to stay with, because it becomes more expensive. It's not cost effective.
Wow. It will be really heartbreaking to find those that are extremely dependent on their caregivers lose their caregivers.
Yes, it was. What I witnessed, I gives me the shivers, honestly. That is part of the reason why I'm motivated to talk to parents, especially those that have adolescents. And I insist on their doing what we call transitioning program, even from the age of 10 years, to open their eyes to what is expected from them for their child to do. We have a 20-point agenda the parents have to look into and get relatives, get friends, get anybody in the school to participate in, so that our kids will have somewhat level of independence when they're older. Some of our kids at the age of 15, they cannot still cross the main roads. They cannot walk by the side of the road because they've been coddled at home. They've never left home. I know of an 18-year-old that never left home. So how will he walk by the side on the road, by the side of the road? How will he dodge the taxis and the craziness on our streets?
Another thing is, some parents tend to hide their children once they discover that they're actually autistic. How do you begin to handle that?
It's more difficult when parents are in denial. But like I said, it took a friend of the family to encourage them to seek for assistance. So if there is awareness and advocacy, and they hear that autism is not a spiritual problem, it's not their fault. It's okay to have autism. I have autism myself. After all, you don't even know who made your clothes. You don't know who made all those designer shoes. You know whether they have autism or whether they were in the spectrum or not. So who are you to say because this child has autism, then this child cannot amount to anything? I mean, that is wrong. We should give equal opportunities to everybody, including our kids with autism. So parents shouldn't be afraid to own up or advocate for their child. I mean, when you advocate for your child, it gives that child confidence to forge ahead in life. So when we see those parents, we talk to them and we counsel them and we tell them there's nothing wrong with you having a child with autism. There's so many successful people that were in the spectrum and they did well.
I've always heard that autistic children tend to be genius of some sort because they're pretty good at the things that they do. They pay so much attention to them and they are super talented. How true is this assertion?
Yes, it's true, although it doesn't apply to everyone. We call it servant skills. You're so good in this. That's why autism is different. You see someone that is so good in painting, and in painting, doing artwork, what's different is difficult to read. Their skills as if they're just being as if God made them to specialize in one thing, and every other thing you're talking about is just different. Autism can be that way. Yes, I've seen kids that were exceptional. See kids that could play the piano. I had a child. She was non-verbal. I mean, she wasn't conversational, but she could learn music. Like just give her 48 hours, and she will learn that music. So when I discovered it, I told the parents to start music training for this child. Of course, I disturbed them for 2 years before they agreed to do that. And then, even when we went for occasion, this child was able to sing her own song and sang another person's song, which we didn't teach her. The person was being taught in another room, and she sang the person's song, which was so impressive. And guess what? Last year, when they did autism awareness at Hilton in Abuja, who played the piano? It was the same girl. I told the
Wow.
parents, I want to see this child in American Got Talent as the next Cody Lee, and she was exceptional. I've seen those that could paint very well and good pieces, artwork like Kanye. There's so many of them. So I tell parents now, if you just discover something different about your child that appeared seemingly very good, pursue it. And that is part of my recommendation. Your child loves music, pursue it, even if it's once a week. Your child is so good with the hands. How about beading, braiding hair, making clothing? Even if it's once a week from the age of 8, pursue it. You might never know. There's a child I know, he's an adult. He's a lecturer right now because he was so talented in mathematics and physics. I can't even do physics right now. Can't even remember the basics. But I mean, he teaches in a university in US, teaches maths and physics. The parents told me, and I was so happy for them.
Oh,
At least we draw strength from all these stories, which are real and valid.
wow. That's pretty interesting. So, looking at solutions and management, what are some common early intervention strategies or therapies that you can recommend for children with ASD?
The early intervention strategies includes early diagnosis, even while waiting for those diagnoses, because it can take a while. Remember, I mentioned the early warning signs from the age of 6 months, even from 1 year. You could start doing something before you have your final diagnosis. Don't just hold your hands. You can actually start speech therapy for your child, engage family integration, engage the child at home, reduce screen time. I've seen parents
Oh,
that said, this child watches television, the child will learn from television. You see this child, the last parent I had encounter with said this child could watch television for 6 hours. Screen time will reduce the amount of time your child needs to interact with fellow human beings. So you see our children mentioning words, but they're not interacting. Reduce
oh,
screen time to less than 2 hours or 1.5 hours, if possibly just 1 hour to watch educational stuff or films, and then use the other ones to your child. Give time to your child to interact and then teach them how to play. That is the one you can do for yourself. Nobody will do that for you, no matter what the therapists are doing. That is your own. Have friends, go and play dates, go to parks. Okay, you can't just dump your child in school. Oh, and my child starts second nursery school early. Maybe this child will talk. What are you doing at home as a parent? Then other management protocols include behavioral, developmental, educational, social, relational, pharmacological, that's medicine, psychological, and then alternative forms of treatment. The evidence-based is the applied behavioral analysis, which believes that something, applied behavioral analysis, that's what we call ABA, is evidence-based, is a science in which the procedure is derived from the principle that there is an antecedent, something always causing the behavior, and then a consequence is that if you're able to manipulate the consequence, that child will perform better. For example, the child is not talking, and then the child wants food. If the child says food, and you give the child food, what will happen? The child will keep on saying food in order to get that snack or that food. But if a child cries, and then you give the child food, what happens? It's going to increase the behavior of crying all the
crying.
time to get whatever they want. And that is what we parents do. When the child cries, and you give attention, what happens? The consequence, the child is happy. So what happens? Anytime the child wants attention in
The child
public, anywhere,
cries.
the child cries. And you wonder why the behavior is increasing. So ABA manipulates the behavior and increases socially significant behaviors that will be beneficial to the child while decreasing the inappropriate behavior. And then ABA spans across speech improvement, behavioral modification, any behavior you want that child to improve on. And then sometimes still in that ABA, they have the one they call district triad training. They break down those tasks in small bits. For example, a child is in classroom. This child cannot even count to 1, 2, 3, 4, and you're giving the child something to addition and subtraction multiplication. No, it doesn't work that way. You have to break it down into the tiny bits the child will understand and reinforce. Reinforcement, I call it paying them for doing something. Madam, is for example, if you go to work and your boss tells you, if you spend extra 1 hour, I'll give you 100,000 naira. What will you do? You're gonna spend extra 2 hours
immediately.
Right? I'm telling you that works.
Without second thought.
We call it reinforcement. So ABA therapy is very important. And they will also have the pivotal response therapy, natural setting, whereby you teach the child in the environment that you can even do at home. Instead of, for example, this child wants this particular toy, don't just make things available for them. Madam, if you just cry and your husband buys you on my cheap, what are you going to do? You will keep on crying
all the time.
But if you work for it, you have to teach them to work for it. If you want this toy, you have to either gesture for it or you say toy and I'll give it to you. And it has worked for a whole lot of our kids. So let me just put that in ABA. Then we have developmental. You look at the developmental milestones for example, the speech therapy for them to talk, occupational therapy for them to use their motor skills, the fine motor skills, the gross motor skills, sensory integration. Remember, I talked about those that overstimulated. That's why they're finding it difficult to adapt in school settings. So you have to do sensory integration for them. Then we have educational. Some of them who do inclusive education, using a special center. You have to find out what suits this child best. Not because you want your child to be in a mainstream facility. Oh, I want my child to go to school. Because of that, you dump this child in a regular setting. It does not work. The mainstream education, even though you just still want to do the least restrictive, wanting the child to be with the other kids, your child needs those prerequisite skills to function in regular educational setting, or you set up that child for failure. Then we have the social relational, teaching the child social skills. We have pharmacological. Some of our kids, especially the adolescents, they could have anxiety, depression. Oh, yes, it's real. You have to work on it. Some of them are so hyperactive that ABA is not working for them. They might need medication. Then we have psychological. They need counseling, especially the adolescent adults. Someone has to talk to them or work with them. And then we have other alternative supplemental methods. For example, the diet, the supplements, investigations, and some do music therapy, some do art therapy, some do floor time and all that. That could also help our kids with autism.
Okay, so how do most of the time these children are being segregated against and people look at them like they're abnormal children. So how do you, pediatricians, autism specialists, behavioral analysts, and other neurodevelopmental coordinators help to provide care and educate the children, their parents, and mostly caregivers in general?
Well, we're doing it right now. Advocacy and creating awareness through social media, like you're doing right now with me. So we encourage more social media, and we need to reach the communities, the rural areas. I saw a child years back. One of my relatives, the lady staying with me, so to say, told me, "Oh, doctor, I think my brother has autism." How old is he? 20. He said, "Bring your brother." I went to the village. And truly, it was autism. So it means that there was no awareness back then. The rural communities need to know what autism is. So we need to still create massive awareness. Governmental policies, it just doesn't start with the doctors. We need to, and it starts with we as a parent, caregiver as well. We need to tell parents anywhere surveillance you see a child with developmental might not meeting up with developmental milestones, we need to tell the parents, even if they are in denial. For example, when they go for their immunizations, it starts from 6 months. Some hospitals are so good, they do developmental checkups, screening or checkups. So when they see lags in developmental milestones from the age of 6 months, even 12 months, 2 years, they're supposed to tell the parents, even if they go in denial, and send them to appropriate places for screening. When they go to school early because they're not talking, some schools are afraid of telling parents, Madam, I think your child might need further assessment, because once they tell them, they withdraw their child from that school. That happens. So parents should still just be open to suggestions, because by the time you start early intervention, you will thank those that saw and they told you. Then awareness, and making therapies, making resources available and accessible and affordable to parents.
I remember
Apart
seeing
from that, put it in NHIS. If NHIS can cover part of the therapies, I'm sure many parents wouldn't be afraid of bringing their child for therapies, even if it's once a week. That would help them.
I remember seeing something around being autism treatment and management being very expensive. I don't know how true that is, but that's why I'm putting it out to you. I think I saw something, there was a movement for raising of funds for parents that actually have autistic children, and there were conversations around it being very expensive to manage. How true is this? And are there support groups that also help the parents? Because basically these things tend to affect people's mental health. So especially because of the way the environment tends to respond to it, the community in general tends to respond to both mother and child, or parents or family in general. Are there support groups, and how expensive is it to actually manage autistic children?
Yeah, it's quite expensive to manage a child with autism, especially the adults, the adolescents. For example, imagine, what the school fees is like right now, apart from the pandemic and our inflation right now. So you see, how will a parent pay, for example, 200, 300,000? Let's say from 100 to 300,000, that's what the current rates are in Abuja right now for school fees. And then you also come and pay from 70 to 150,000 per month for a child with autism, because sometimes our kids just go to school, they learn social interaction, but the ABA therapy is actually the core thing they need, and the parents cannot do without it. How many parents can afford that when their salaries can't even feed them at home? It's extremely very expensive. Some might have support, and yet they will tell you, Doctor, we don't even have the transportation to come to the center for therapy. So if there is someone, or if we have facilities, or we have NHIS philanthropies who could say, okay, I'll sponsor this center to take care of 10 children with autism for 6 months. Can you imagine what would happen? You can also do more if the people given the money, they can insist, oh, we want to know updates and make sure these children are improving and work is being done on them. Those things can be arranged. Parents suffer a lot. Some of our kids have special diets. They have restrictive diets. They don't want to eat particular things. If you don't give them that thing they want, they will starve, even if for 2 days. It's a parent buying so many foods, just apart from the family diet, to sustain their child with autism. Some might need to go into special diets, really, like the gluten-free keto diet, to reduce some of the symptoms you see in our kids, like hyperactivity, sensitivities. Some diets has been seen to help some of our kids with those. So, and they don't come cheap. Then imagine, because you have to go to work, you would employ someone 24 hours to stay with your child at home. You have to pay the person. And if you need to do transitioning program for adolescents and they have to go to the workforce, you have to pay the workforce to pay your child. They have to pay their transportation and pay the transportation of the person that goes to that place once a week, so they can learn what it means to be responsible. It's a whole lot. What about their medical needs? Some of them have
Mm-hmm.
other medical needs like gut issues,
Yeah.
seizure disorders, food allergies. You have to take
Wow.
care of them as well. What of those that have like depression, anxiety? You need to also see a psychiatrist for that. What of those that need counseling? If they need counseling from a psychologist, you have to pay for that. And yes, some of them even when they go to regular school, maybe for the merge, and they need a shadow, a therapist that goes to school with them to make sure they are included in what happens in school. Because if you don't have a shadow, I am telling you, if it's not an inclusive educational system and you don't have a shadow or a therapist that goes to school with your child might be neglected. Can you imagine in a class of 20 and they have two children? Do you think it's possible for them to pay particular attention to your child when they have
Exactly my
20 or more
thoughts.
children in that same class? How possible is it? I tell parents, this is not possible. There's no way these two teachers will do that. They will have burnout. Or rather, they allow your child to do whatever he or she wants in class, whether he's learning or not. So imagine you need to pay somebody to be in class with your child to ensure participation, cooperation, learn how to imitate and play with other kids in class. It's expensive. And most of the therapists are graduates and they have done tons of trainings. So it's not cheap.
Wow.
So it's expensive.
Thank you so
And
much,
then what
Dr.
about
Doris.
parents? What about parents that will need to leave their job to take care of their kids at home? You see one person, maybe the father most times, struggling with finances, and then the mother stays at home or cuts her own working hours to spend more time with the kids at home because their nannies ran away. They couldn't cope. These are real life stories. We've seen a lot. It's not easy on our parents. I said parents having their own burnouts, being agitated, depressed. It's not easy. They want to scream down. It's not easy for parents as well.
I can't let us round up this show without having you at least give one or two advices to parents who have autistic children.
I just want them to know that every child is a gift from God, no matter how bad they might feel that this child is not reaching the potential the parents have mapped out for them when they were born. I just want them to know that they should take autism as autism has come. So take it as it is and be happy. Find that beautiful thing that your child can do and improve on it. You understand? Don't condemn your child. Keep on striving. Start early intervention. Don't be in denial. Fight like the tiger. Fight like the lion. Because if you don't advocate for your child, nobody would. But the power you have as a parent is enough to open doors for your own child. If you cannot afford therapy, fine, the internet is broad and wide for you. Find that which you can do at home to improve the skills your child needs. Even if it means participating in house chores, that is something. Taking care of himself, bathing, brushing, sweeping, washing, that is something you're doing something. So you can do it no matter how hard it is and make sure you're happy as well. Make sure there's happiness in the house. That is my advice for you. Don't ever think of giving up. You cannot have that in your dictionary. Never say never. Please.
Thank you so
It's
much.
good to cry once in a while, but never even dare give up. Okay?
I love that. Never even dare to give up.
This is from parent to parent. Don't ever give up. Okay?
Thank you so much, Dr. Doris Izuwah, Autism Specialist and Behavioral Analyst. Thanks for your time in the studio today. Thank you for your time on the show, rather. We really appreciate you.
My pleasure always.
All right, viewers, that's where we'll draw the curtains on today's episode of Healthy Living. Dr. Doris has said it all. Don't even think of giving up, because there's always light at the end of the tunnel. That's all, Dr. Cousins, on today's show. I am Olamide Alhassan. See you again next time.